Hello, I am Anne Arundel County Executive Stuart Pittman. I have with me our Anne Arundel County Health Officer, Dr. Nilesh Kalyanaraman. And we're going to spend the next hour talking to you and answering some questions and hearing concerns about the state of the coronavirus pandemic in Anne Arundel County and also in the state of Maryland. This is not a town hall that we had planned in advance. We decided this morning that we needed to get online and talk directly to the residents of Anne Arundel County. Anybody who's been following the news locally has noticed that we're starting to see in this county and in this state some of what's been going on in other parts of the country, which is a surge, an increase in the numbers of cases. More ominous than the increase in cases that we've seen in the last 2 weeks. We knew that we would have some increase with increased testing. We expected that, but an increase in the number of infections that we're seeing per infected person. So I've found that probably the most important metric that we really have to watch is the rate of spread. And when we have a rate of spread of 1, that means that for each infected person, they're approximately infecting 1 person, and then the infection rate stays about the same. The state of Maryland and Anne Arundel County got that number well down below 1 for most of the month of June. We acted, we flattened the curve. Our businesses and our residents did the right thing, and it was working. So we were winning. As of really early July, both the state and the county started to see some increases and brought that number above 1. So we're at 1.2 right now in Anne Arundel County. And simple math tells you that if 1.2 people are catching the virus from every person who has it, that will be an accelerating curve. And if behavior continues the way it has continued, the way it has been, during the month of July, we are likely to see a surge that is going to eventually get us to the point where our hospitals are overwhelmed. Let me read a quote just from the website, COVID Act Now for the state of Maryland. Based on our new numbers that show us above 1, they say the total number of active cases in Maryland is growing at an unsustainable rate. If this trend continues, the hospital system may become overloaded, something that we obviously don't want to have happen. Our hospitals have brought back, they had cleared out a lot of their beds, making room for the first coronavirus surge. And they didn't do the surgeries that people needed, and people weren't getting the healthcare they needed. So they've started to fill those beds back up again. So we're not in a position to have a major surge. We also, as we project out, we want this fall to see, if anything, lower numbers than we have now. There's a lot of conversations about whether schools should open in the fall, and with the direction that we're heading right now, it doesn't seem like a wise move to open schools in person. In fact, I know that my wife, when she filled out the form for our kids, actually said, when she filled it out a few weeks ago, that she would support a partial opening of schools. And the current numbers have certainly changed her opinion, my opinion, and we can't open if we don't get the numbers down. So the change really happened, the most recent change in activity where the numbers started to go up mid-June. That was the last opening in the governor's roadmap to recovery. There were phases. A number of things in phase 2 happened some on the 12th and some on the 19th, opening restaurants to indoor dining and bars, removing the 10-person limit for gatherings, gymnasiums, malls. And it was about 2 weeks after that we started to see these numbers increase. The governor's roadmap to recovery is very clear that it says that when you start to see that increase, they call it a stop sign, and that's when you go back. So over this weekend, I've been having conversations not only with our health officer and others on our team, but also with the county executives in the larger central Maryland counties that have similar rates to ours. And the health officers have been in communication with the state. In fact, a letter today went from all of the health officers of the top 6 counties to the State Department of Health, encouraging them to consider some changes to change behavior again, to roll things back, to lower our numbers once again. We have not made decisions. We are coming to you tonight because we don't want to make these decisions behind closed doors. We want to hear everybody's views on this. We can't hear everybody's, but we're going to be doing a meeting of our recovery work group tomorrow to hear from our businesses as well. It's just very important that all of us understand the facts as we make these decisions. And so we've got Dr. Kalyana, who will go through some of those numbers with us and give us, from a public health perspective, what the scenarios might look like. And before I turn it over to him, I just have to say that I know that our businesses have worked really hard. In fact, we put all of our small business assistance, $5 million in grants, specifically into helping our businesses transition to be able to operate safely with our customer and employee protection program. And they have learned how to operate safely. And I've always said, and I'll continue to say, that anything that we can do to slow this spread without putting people out of work, we have to weigh the cost of the economic cost and the cost of people losing their jobs. And it's mostly the low wage hourly employees who are losing work in this pandemic. So it's really difficult. We really are in a difficult position, having to make some difficult choices. And I just want everybody to understand that that's what we're faced with, and that we understand the impacts of what we're talking about. So I'm going to turn it over to Dr. Kalyana, who is going to go through some of these numbers with us. Then we'll have a little discussion about that. And then we have lots of questions from people who have emailed in or on Facebook Live. Dr. K.
Thank you, County Executive. I wanted to share a little bit about the picture that we're seeing with COVID now. Actually, today we went over 6,000 cases in the county, and we've had over 200 deaths as well in our county. The pandemic first hit in March. We saw our cases rising in March and April, eventually to plateau, and then start slowly coming down in May and June. During those early months, we built out a first-class contact tracing team, and they've contacted every one of those 6,000 people who've been positive. We've built out, and we're continuing to build out, a testing infrastructure between us, the health department, primary care, hospitals, urgent cares, nursing homes, and others. And we set ourselves as a goal to test 2% of the population per week. So that's 11,600 people. And we're well on our way there. Last week, we tested over 1.5%, so over 8,000 people. And we're going to continue to grow that in the coming weeks. Our hospitals developed the capacity to handle the surge in patients, but they don't want to see that surge. Since right now, they're just building back to do the elective cases, handle the emergencies, and keep people safe in the hospital. That has always been their role. And a surge would disrupt their ability to do that again. We don't really want to go back there. In terms of our health equity measures, we're doing a much better job with controlling the spread amongst Blacks. The percent positivity is now down to about 3.6%, which is great progress. Unfortunately, we haven't made those gains with Hispanics, who are still above about 14%. And so there's much more, as much work as we've done, we need to redouble our efforts there. Focusing in a little bit over the past month to month and a half, June 12th and 19th were the last time we made changes to reopen, with gyms, indoor dining, indoor and outdoor amusement, and malls opening back up again. In the 2 weeks after those reopenings, we saw a slow increase in cases, which we expected due to the reopenings. Then a few weeks ago, we started to see the rise in cases, and that started to go much faster and hit a high of 89 this weekend. I'm going to show you a few slides just to illustrate what we are seeing. So bear with me for one moment. So this is the rise in the cases that I was talking about that we've been seeing. And while it gets a little bit jagged at the end, the trend is pretty clear that it's moving upwards. We knew we were going to see more cases as we tested more. And I mentioned that we're doing more testing. And so one of the ways we can tell if those additional cases are because of testing or because there's even greater spread in the communities through our percent positive tests. And one of the things we want to make sure is that we see our percent positive is staying under 5%. What we've seen in the past 3 weeks is that we were down at around 3.1%. And since then, it's been steadily growing. You see this blue line is our average. The day-to-day is pretty noisy. And our average is up to 4.7%, and we've been consistently going up. And we know that we're heading in the wrong direction, and that's a warning sign. At the same time, we're seeing our hospitalizations go up. That's this blue line. We hit a low, and now we're moving up, and we're just about, I think, 37 was the latest count. Once again, this is a manageable amount, but you can see that in the past week, it's going up pretty significantly. And what's manageable now can become unmanageable very quickly. As the county executive noted, one of the most important things to consider as well is what's the rate of spread. That's the infection rate. Anything less than 1 means that we're controlling the virus. Anything more than 1 means that we're not. And the higher it is above 1, the more quickly it's spreading. And as you can see here, it's been growing, that rate of spread, and it's up to 1.21. And that's concerning to us because it means that the virus is spreading faster and faster. When we look at all of these signs together, cases, hospitalizations, percent positivity, the rate of spread, it shows that our county is seeing a dangerous increase in cases. I mentioned our contact tracing, and we look through that to see what patterns and trends there are. In discussions with our contact tracers, I've learned the following things. While there are still cases across all ages, there are growing numbers of cases in people between their teens to their mid-30s. Before, we used to say that it was, on average, we'd see about 3 to 4 contacts per case, and every once in a while, we would get as many 10. Now we're routinely seeing 10 to 20 contacts per case, and in some instances, more than 20. Contacts are happening in a variety of settings: restaurants, bars, malls, shopping centers, parties. There's a lot of different activity going on. And the contacts are across all ages. The challenge we have is that we've seen this pattern unfold in other states. If you read the news, you see that Florida, Texas, California, and other states are struggling. Cases start to rise slowly at first after reopenings and then much faster afterwards. It leads to increased case spread, hospitalizations, ICU usage, and then death. Not everybody progresses through that, but as that grows, as the spread grows, the numbers in each of those categories grows. Over the past few days, I've had conversations with leaders at the University of Maryland School of Public Health, with the Johns Hopkins School of Public Health as well. I've shared our data with them and asked them for their thoughts. They too share our deep concern and think that we're headed in the wrong direction and that we need to act. I've been in discussions with other health officers in Central Maryland who are seeing similar trends, and they're also deeply concerned. I know that our county's recovery work group is meeting tomorrow. Over the next few days, we'll be working with these various groups to understand what we need to do. The challenge is that our decisions, whether they are to act or not to act, have economic, social, and health consequences for each of us. Our long-term goal is to keep the virus suppressed, so that we can keep businesses open, so that we can get to school being open in person. And today we just learned that the schools will not be opening in person come September. And ultimately to keep people safe. But to do all of this, we're going to have to make difficult choices in the coming days. So with that, I'm going to turn it back over to you, County Executive.
So, yeah, it's not a pretty picture. You keep saying, Dr. K, that that there's no question about it, that continued interactions. We didn't even talk about the cell phone data that shows our mobility numbers that have gone up. I noticed that we have an F according to the tracker on that right now on unicast.com, as does the state. Are there I mean, is there a way through public information campaigns? We just announced the mask order being required, both indoors and outdoors in the county when you can't social distance. Is there work we can do on the enforcement side that would help?
Yeah, there is work that we're looking at on the enforcement side. We've really focused on enforcement being a collaborative process to educate and to help remediate. But what we're finding is that while a good number of businesses are doing what they need to do, there's also a lot who are not. And we're going to have to look at stepped up enforcement, including fines, to start off with. The challenge is that giving people multiple chances means that there's spread continuing. And ultimately that's damaging to all of us.
So just to be clear, right now, when somebody from the health department goes to a business, usually it's because somebody reported them, and then they go there and they find that people aren't wearing masks, or there's some kind of protocol that's not being followed, or there are too many people there. They give them a warning, and then they come back and check again. Is that right?
That's correct. Yeah.
Okay. So I know what you've proposed, that it's at least under discussion, is that there be a fine on the first infraction and then a closure on the second. Is that accurate?
That's what we're discussing right now. Yes, okay. Because we are losing time right now.
So I know that in Prince George's County, the county executive has organized a group of ambassadors who go out to businesses to try to do enforcement. It's not an easy job for the inspectors, I know.
No.
And we've actually encouraged people to report situations that they feel that are not safe, because we can't do it all through inspectors. So that's one thing that's on the table. I understand. Okay. Yeah. Okay. And that's something that your staff is really eager to do. I also understand, because they're kind people.
It's not their usual mode of being. They're usually looking to help people and help them do the right thing. And as we talked about, there are difficult decisions right now that means that we're just losing time on controlling the spread.
Okay.
So we're talking internally about how to make that happen.
Okay. So I have a question here. Julia says, why aren't asymptomatic people being told to quarantine after a test until the results come in?
So we generally,
or are they?
Well, asymptomatic people fall into two categories: people who might have been exposed, or people who are doing it because they've chosen to. Generally, if there's an exposure, we do tell them to quarantine. If they're just coming because they felt like it, we don't. So that's the reason we might not tell that to everybody. We're also, of course, tell anybody with symptoms that they have to quarantine until they get their results. But we're also finding that not everybody is doing that. Particularly when people have milder symptoms, they're doing what they used to do, which is push through. But we know that in the time of COVID, that's not the thing that you should be doing. And so we'll be working on not just our messaging, but remember, there's testing happening across the county. Different providers are doing it. So making sure that all the providers understand that that's the message they need to get out.
Yeah, let's talk more about testing, because you set a goal of testing 2% of our population every single week, at the point where you were testing at that time less than 1% every week. I mean, we know there's a state goal that the governor's put out that is test 10% of your population from the beginning of the pandemic, but we're course, we've done that, but we're really, we're concerned about now.
Yeah.
Because whether people were tested a month ago, that's really old news. So you managed to get up in just 1 week, you got up to 1.5%, which is how many people? It's
That's over 8,300 people.
wow, in 1 week. Okay. And so who are you encouraging to get a test, and where do you suggest they go?
Yeah, so there's testing sites. If you have a primary care doctor, you can ask them. Pharmacies around the county have it. The health department, we're doing pop-up testing every Monday in multiple locations. We have drive-through testing 6 days a week during the day in Annapolis at the health department, and Tuesday evenings. We're doing testing in the Glen Burnie Veep as a drive-through on Wednesdays and Fridays. Urgent cares are doing testing. I mentioned pharmacies. So all of that information is on the health department website. We have a testing calendar for the health department, and then a map for testing sites, not just for the health department, but all of these different entities across the county to try to make it easier for people to find a test site.
And what does it cost?
It costs, if you do it with the health department, it costs nothing. If you have insurance, we'll bill it. If you don't, we don't charge you at all. We're finding that most of the providers are not charging anybody, but if you go to somebody other than the health department, you should call ahead to ask if there's any charge. And
do they need to make appointments?
Generally, we suggest you make an appointment. It just makes it faster and we can see more people, but we're absolutely available for drive-throughs or walk-ups, just depending. We will accommodate you.
And what are you as a health department doing in terms of, where are you going to make sure people get tested? Are you testing workplaces? We know you're testing congregate housing facilities.
So a lot of the testing has really been geared towards where in the community we're getting requests for testing. So we've been testing throughout the county. We've been in Annapolis and West County, Brook Park, Glen Burnie. We've been in South County. And all of these are generally partnerships with either libraries, houses of worship, or the two biggest ones. We've done it in concert with public housing. I know coming up soon, we're going to be doing it with Gersbeck's and Atman Property out in Sun Valley, the shopping center there. So we're really looking to expand in the number of partners we have. Our goal is to make sure we're testing where people want to get tested. One of those keys is really testing workers, frontline workers, people who go to work every day, interacting with the public, and don't really have a chance, right, to work remotely during this time. We want to keep them safe. That's a real goal of ours. And so we'll be expanding those types of opportunities for testing as well.
So when we announced the mask, outdoor mask requirement, we also announced that for excluded workers who couldn't get unemployment insurance for some reason, that we were going to be providing some financial assistance, debit cards, $500. Do you believe that that for low wage workers, hourly workers who will be replaced if they leave, and who may not get hired back and who won't get paid if they're sick, is there a disincentive to get tested, and how do we fix that?
Yeah, that's something that we've heard a lot actually from our health equity calls, is exactly that issue. I think the excluded worker, that program is a fantastic program to help with that. Our goal is to make sure that we're supporting people. We do that. That's why the testing is no cost. That's why contact tracing does case management. And we're waiting to hear back from the community as to how that's being taken up. And if that's sufficient to help people get tested, to want to get tested. It's real hard. If you have to make a choice between losing your job or finding out if you have COVID, I think we all know how that's going to work out. So it's really our responsibility to figure out how to resolve that problem for people so that they get tested and keep themselves and others safe too.
So for people listening, go to Anne Arundel Workforce Development Corporation, their website, to get information about that program. I haven't gotten statistics from the whole first week. I know the first day they had 179 apply, and we can get information on that, and we'll get that out too. Here's a question from a reporter at the Patch, Jacob Baumgart. What do you want to tell people? What do you want to tell people who refuse to wear masks? Maybe there's two. What do you want to tell them? What do you actually tell them?
Please wear the mask.
Please.
It's really interesting. Right? Masks they're low tech, and yet they are the single most effective prevention we have for it. If everybody wore a mask when they were out and couldn't distance, we would be in such a different position. It would be amazing. I can't say enough. I have 3 masks literally everywhere throughout my bags and my house and my car. It's not a political thing. None of us care about your politics. We just want you to be safe. I don't know how else to beg. I will beg if you need it. Just please wear a mask for yourself, but also for others you care about.
And I would add to that, our slogan has been "Keep Anne Arundel Open." That if we want to keep our people working and our businesses operating, we have to keep the numbers down. Period. Even if we don't do anything in the next month to roll back anything, if the numbers keep going up, eventually we have to. And the more they go up, the more we have to act. We definitely don't want to have a shutdown, a stay-at-home order. We don't want to close anything. So wear a mask to keep Anne Arundel open. It's and obviously social distance. Can you tell? This is from Claire. Can you tell from the data whether the surge in cases for COVID-19 are from the people who are asymptomatic or symptomatic? How are you determining if more people are getting exposed? Or are we just finally seeing how many asymptomatic people are carriers?
It looks like from our contact tracing data that it's actually symptomatic people. Some of the symptoms are milder, which is why I was mentioning that there are people who, with the milder symptoms, are not isolating while they're waiting for their test results, and that's leading to more spread. There's absolutely some asymptomatic folks that are being picked up as well, but I don't think that they're driving the trend that we're seeing right now. And
if you get tested and you're positive and you're an asymptomatic carrier, what should you do? And this is a question I've never heard anybody ask. Do you ever stop being a carrier?
So what you should do, and we'll call you if you test positive, is that you do need to isolate, and the health department will go through it with you. How long you need to do that, and what other precautions you need to take, and go through that contact tracing. Do you ever stop becoming a carrier? Yes, you do. And actually, there's new guidance that just came out about people who've been positive not getting retested for another 3 months. And some of that has to do with the fact that when you have the virus, you can still test positive for even a week, 2, 3 weeks after your symptoms have gone away. And that just has to do with your body healing and like dead virus shedding. And so the new recommendation is that actually you don't get retested because you do have some level of immunity. How long it lasts, we're still discovering that, because really at this point, we're only in month 7 of this virus even existing. And so while there's a lot to learn, we do know more and we learn each day. So it's good to see that there's some level of immunity for a number of months after you've been infected.
Okay. All right, here's one that's frustrating. Julia says COVID results take up to 10 days. When will the county have expedited testing options? And it's not usually taking that long, and it wasn't taking that long. We were certainly down to 3 days and sometimes 2. I know I got my results back. I think I tested on Wednesday and heard on a Friday. But it's getting slow, and why and for whom?
Yeah. So You're right. It was about 2 to 3 days to get results back, and this was true about 3 weeks ago. And then when the different states started to see their spikes, they started testing a lot more, and that flooded the laboratories. We're using commercial labs that are getting tests from all over the country. What we're seeing is that we use two different labs. One of them's got about 3 to 5 days, and the other one was up to about 7 to 10 days, but it's coming down. I just found out today that it's down to 4 days, and it's on its way down to about 2 to 3 days. So I think this week we will see that it's gotten much better. But you're right. For the past few weeks, the turnaround time has been bad.
And when you say the labs we use, you mean the labs the Anne Arundel Department of Health uses, right?
Correct. But most of our partners out in the community are using similar labs, and everybody's really faced the same just onslaught of testing.
Okay. Here's another one. And we haven't talked about this one much because I think this is more of a state decision, but maybe not. With surging cases across the country and our state's hesitation to place any travel restrictions on or quarantine requirements for high-risk areas of the country, has the county thought about placing stay-at-home or quarantine requests for those traveling to places like Florida or Texas? And I know that when you were in conversations with the health officers, that came up on one of your lists. Do you think we should be quarantining for folks from outside, from hotspots?
Yeah, we've been talking about that. Right now, there's an advisory for people to travel out of state for whatever reason to get tested when they get back. It's hard to take that kind of step as a county. That's the kind of thing that you really need the states to have a more generalized policy, particularly if we're going to try to start quarantining people. That's really challenging. And so we've been talking to the state about that. And really, I think that that's a decision that they'll have to make.
It would be particularly difficult in a county where we have an airport and people are flying into our county. But okay. Let's see. Somebody's asking why we don't mandate wearing masks outdoors. We do.
We do. And that's what we did about 10 days ago, the Friday before last, requiring people to wear masks in outdoor public areas when they can't distance. For that exact reason, is that you can spread it when you're outdoors and people are up against each other. And we talked to the police, we talked to the Anne Arundel County Police, we talked to the Annapolis Police Department. And once again, our goal was to support people. We gave them masks and literature to hand out, and the police were handing out masks. Most people were pretty good about it. From what they told me, there were a couple of tense moments, but overall, people got it. But I think the challenge is that the more masks the police have to give out, that means there's more people who just aren't doing it to begin with. And we really want to see to the point where they don't have to get masks out, where everybody's already doing it.
So I know that one of the fears right now that people have is what's going to happen to our people who are not working, who've been getting unemployment insurance, who've been getting the extra $600. The maximum in unemployment insurance in the state of Maryland per week is $430. So folks were getting $1,030 will be cut down to $430. The funding for that would come from the federal government. And if you're following that news, please talk to your senators and your representatives. They're arguing politically back and forth over how to do an extension of unemployment insurance and additional funds for localities. One of the great things that they did, of course, was the CARES Act funding. So Anne Arundel County has money to be able to pay for some of our contact tracing work, pay for this excluded worker humanitarian fund that we started, pay for a lot of the food and food distribution work that's going on around the county where the demand is gone beyond what we've seen in our lifetimes for food assistance, and an eviction prevention program. And I know that in particular, a lot of people right now are concerned about the eviction cliff that has been described. If the governor were not to extend the state of emergency for the pandemic at the end of July, then the ban on evictions would be lifted. I expect everybody, I think, expects the governor to continue that because we're clearly not through this pandemic, which means that that ban is still in effect. However, the courts are opening, and there is going to be a need for, down the road, not too far out, some major help for renters and homeowners for eviction prevention for both foreclosure and non-payment of rent. And so we as a county have a program through Anne Arundel Community Development Services for financial assistance. The money goes straight to the landlords, but a counselor works with the tenant and the landlord to figure out how much they need to pay to be able to stay in. We expect that we're going to have to invest more of our CARES Act money in that. And we have been encouraging the governor to make it clear that he's going to extend that moratorium, but also invest state CARES Act money more than they have now into eviction prevention. So these are all the economic factors that we're having to look at. And then the question becomes, well, why would you make it worse by, potentially closing down some businesses that have reopened? What if the governor or the county executives in Central Maryland were to decide that these bars and restaurants are just a place where contact tracing and everything else is showing us the virus is spreading. So it's putting us in this place where it's going to get worse and worse. That's what makes it really difficult. And it's sort of, we pay now or we pay later, but we have to create the safety net to be able to protect those workers because they're the ones who literally end up with no roof over their heads or no food on the table. Do you have any answers for us on that, Nilesh?
Yeah, I don't have answers, but I mean, that's a thing we think about a lot in public health is we talk about the challenges to people's health who are poorer, who have housing insecurity. And, these are things we know are intimately involved in people's health, and it's all coming together at the same time right now in a way that's really just devastating. And so all of these, we have to balance those different challenges people face. And what can we do? What can we do to balance that? We don't want you to pick between being sick or having a job, right? Like, we have a choice to help with that.
So one of the things that's, I don't know if it's unique, but it certainly seems to be pretty close to unique about the Anne Arundel County contact tracing program, unlike many others, is that we do the case management with it. So contact tracing, that the state of Maryland, most counties didn't do contact tracing at all in the beginning of this. It was just, and we looked at it and we thought, is there any way we can really keep up and do this? And you and your staff came up with a plan to move people, school nurses in particular, and school health staff into these positions to do the contact tracing from day one. But instead of having like a phone bank run by a contractor that is outside the state, making phone calls to people for contact tracing, we have local health professionals who are doing it. And when they find a family who lives in a small space with a lot of people, or doesn't have the ability to buy groceries and pay rent if they're not working, what's the role of the contact tracers? What do they then do?
Yeah, so we call them contact tracers and case managers because that's a core part of what they do is figure out what people's needs are. Is it food, which is oftentimes the biggest one, but also there might be some issues around housing and how do you separate enough from others in the household so you don't get them sick, or getting transportation to a medical visit. So we talk to them. What are your challenges? What are your needs? And then we'll partner with other agencies, with nonprofits, to get them the services they need so that they can recover, and so the others around them can be safe too. And we've put people up in hotels when we've had to, and that's absolutely an option. We've arranged for food deliveries. We've transported folks to dialysis. Really, whatever it takes is what we're going to do in partnership with others.
Okay. Well, thank you for that work, and thank you to everybody on your team for doing that work. So we're going to wrap this up, but I think it's important for people to have a sense of what comes next. You know, we've kind of laid it out there that we're facing some numbers that everybody in the scientists say we must act, we must do something. So we're meeting tomorrow with our recovery work group to get some input. The county executives in Central Maryland have been in communication, as have their health officers, who have been in communication with the state health department. I'm going to be getting in touch with the governor's office tomorrow to let them know what we're seeing and encourage them to listen to the health officers. And then the governor normally makes an announcement of some kind, a statement, Wednesday afternoon. So we'll hear what the governor decides, or maybe we'll hear in advance. We hope that there'll be communication between the state and the counties on this one, so that we can plan together. And then my hope is that by Thursday, we'll know what steps we're taking, and implement them fast. Because as you always say, the sooner you act, the less you have to act, and because we're talking about infections. So waiting around is not a wise move. Anything you have to add? You want to add to that, or?
Yeah, you ultimately, each of us has we really have the ability to decide how this goes. So wear a mask when you're out, when you're near others, when you're outdoors. Keep your distance. Get tested if you have any symptoms. Get tested if you think you may have been exposed. If you're going out to restaurants or to malls, and then answer the phone. Answer the phone when our contact tracers call you. If they do, it's because you're positive. And if everybody does those 4 things, we will be in so much better shape. And we're really having these conversations because not everybody is doing all of those things. So please do your part.
And I might even add to that, instead of if you're going out to a restaurant or the mall, maybe think twice about going to the restaurant or the mall. When the governor removed the stay-at-home order, he changed it to a safer-at-home order. So it doesn't mean that we should all be going wild. So stay safe, everybody. I wish we had better news. Maybe we will soon if we act quickly, and we'll get through this. Thank you.
Thank you.